Hi, I'm Dr. Kathleen Bettine with Kaleida Health and Pediatric Endocrinology. My pronouns are she, her, and hers. And today I'm happy to talk to you about understanding the transgender community. Transgender means gender identity differs from the sex assigned at birth. And I like this gender-bred person to kind of tell you the different things that go into your identity. So gender identity is what you think you are, your womanness or manness. Your gender expression is how you lead your life. If you dress in dresses versus in jeans all the time, that's your gender expression. And then there's anatomical sex, which generally leads to the sex that you're assigned at birth. And your gender identity is not the same as your gender expression. It's not the same as your anatomical sex. And gender is not the same as sexual orientation. So sexual orientation, you are sexually attracted to someone and romantically attracted, which is totally different than being transgender. The term transgender is from the late 20th century. However, history shows us that individuals who identify as transgender existed and exist in every culture since recorded history. Transgender individuals is an incredibly diverse population of people, and there are different words and meanings. There's trans woman, trans men, or non-binary, meaning you are not believing in just male or female. Gender queer kind of refers to all of these terms. Gender non-conforming is also very similar. Agender is when you don't identify with any gender. Bigender is when you identify two different genders. Gender fluid is exactly how it sounds. People are one gender one day, and in another situation they can be another gender. And then there's lots of other terms. And transgender, you can be transgender with or without hormone therapy. You can be transgender with or without surgery. Some of the important terms that I want to talk about: gender dysphoria is when you have discomfort or distress caused by discrepancy between one's gender identity and sex assigned at birth. Cisgender is when an individual identifies as their sex assigned at birth. Coming out is the process by which a person accepts their gender identity and or their sexuality with themselves and shares with others. Gender binary is the cultural concept of two traditional genders paired with their sex assigned at birth. Misgender is when you refer to a person with a gender pronoun that they do not identify with. Dead naming is referring to a person by the name they used prior to transitioning. Mix is a gender-neutral title that replaces Ms. and Mr. And gender queer can mean several meanings: bigender, pangender, agender, gender fluid, third gender, anything that's different than the gender binary. So coming out is the process by which someone accepts and identifies with their gender and or sexual orientation and shares their identity willingly with others. For most people, this is a series of decisions. It's important to remember that someone may be out in one space, but in others. Pronouns. There are many pronouns that people use. I have listed some of the more common ones: he, him, his, she, her, hers, they, them, theirs, used as singular. Z, here, here's. And you can go on the internet and find probably dozens more. The important thing is to remember to always respect a person's personal pronouns and or their identity labels. The term gender expansive includes transgender children. However, not all gender expansive children are transgender. And not all gender expansive children end up being transgender as adults. In children, gender identity and expression is central to how we see ourselves and engage with the world, whether we are cisgender or gender expansive. Most children have a sense of their gender identity by about 2 to 4 years of age. Parents of gender expansive youth may observe the first signs at around 4.5 years of age, whereas most youth realized their gender was different around 6 years. Many transgender people do not express or understand their gender identity until adolescence or well into adulthood. Gender expansive children tend to do well when the family behavior is gender affirming, meaning that they let the children be gender expansive. One way to be able to explain the concept of transgender to young siblings is to imagine you're an apple Pop-Tart. You know you're an apple Pop-Tart, but someone puts you in a strawberry Pop-Tart box. You are still an apple Pop-Tart, but some people might think that you're a strawberry Pop-Tart because you are in the wrong box. So what kind of challenges do gender expansive youth face? They may feel social pressure to hide their true gender selves. And hiding one's identity or gender expansive traits can lead to depression, anxiety, self-harm, or suicide. Children do best when their families help them cope with social pressure and bullying and affirm their gender expansive traits. Challenges faced by gender expansive youth also includes rejection, victimization, bullying, and when immediate caregivers reject or are hostile to gender expansive youth, they are more likely to experience anxiety, depression, have issues with substance abuse, and experience homelessness. Gender transition may only be social, may be medical, may include surgical, and may or may not include a legal name change. It is all up to the individual about what they feel is important to them to transition. It is important for in the family of the transgender child or the gender expansive child that they advocate for their child, affirm and support their child. Transition may actually be very challenging for the entire family. Relatives, community members will question the family's decisions. They may face harassment. The siblings may be bullied. And parents may stress about whether or not they're making the right decision. And parents might not be on the same page. And then parents may be grieving for the loss of what they had originally expected for their child. Social transition could include wearing clothes of the affirmed gender, adopting hairstyle of affirmed gender, choosing a name that affirms their gender, asking others to call them by pronouns that affirm their gender, and using bathrooms and facilities that match their gender identity. Further transition may involve puberty blockers to give the children time to adjust to possibly going further with hormone therapy or surgery, gender-affirming hormone therapy, gender-affirming surgery, which may include top surgery, bottom surgery, facial feminization surgery, and then legal, there may be name and gender change on birth certificate, school records, driver's license, and other legal paperwork. When someone comes out to you, this is a sign of trust. You should check in with them about how confidential this is. You should not out them yourself. Remember, gender or sexuality is just one dimension of a person. You can show interest and curiosity and ask them how you can best support them. What not to say when someone comes out to you. You look so real. I never would have known. What do you do with your wife? None of your business. I thought you were going to be scary, but you're so polite and normal. I don't care. You'll always be a girl to me. Aren't you afraid of getting beaten up? Meet my friend Tyson. He's transgender. There you're outing Tyson without his permission. When did you realize you were gay? You're not necessarily gay if you're transgender. Two different things. When did you have the surgery? Again, none of your business. These are really questions. I got this from an individual who is transgender who published these questions, and people may remember a few years ago Katie Couric asking people about when they had their surgery. What can we do? Be open-minded, support the child and family. Remember, people should have the freedom to express their identity in whatever way they choose. Accept and respect people regardless of their differences. We are all different and uniquely distinct in the way we express ourselves. We need to embrace our collective diversity. And I just want to say that at Kaleida here, we are working with the community I will miss some of the community partners, but with GLIS and CHP and Kaleida and the Erie County Department of Health, trying to develop services for our youth who are transgender. I have a couple questions that I'd like to address. Can you recommend any children's books or resources for children who have a transgender family member? I actually will have to look this up, but I can post it on the Facebook page. The term intersex, yeah, I skipped over that. I am not a big fan of that term, but it's actually when a baby is born and their genitalia are not completely finished. So either male genitalia that have not been exposed to enough male hormone or are resistant to male hormone, or female genitalia that have been exposed to excess male hormone. We will call these people, because they have some differences in their genitalia, intersex. And gender fluid would be a person that in certain situations feels like they're female, in other situations they feel male, or something in between. It's not necessarily just male or female, but gender fluid just means you, depending on the situation, you feel your gender is one way in this situation and another way in a different situation. Yes, there are lots of support groups for transgender youth. The CHP has support groups, and GLIS also has support groups. If you go on their websites, you will be able to find out more information for signing up for the support groups. How old does a patient need to be to undergo gender-affirming surgery? This is in the Endocrine Society recommendations is age 18, but it is a decision between a patient and their mental health provider and their treating physician. I do know of patients that have had surgery before 18, but the general guidelines are age 18. Okay. Thank you very much. I hope that I was able to educate you today.